My name is Landon Leitzinen, and I am giving a presentation on the disease of tetanus. When I first agreed to researching and giving this presentation, I kept thinking back to the myth, or I guess I can say it is a myth now, but a time earlier in my life when there was a reconstruction of our house. There were a lot of nails, a lot of screws laying around the house, and my mother would always warn me and my brother of stepping on them so we could not attract tetanus. So that being said, needless to say, it is a common disease, and it is heard often, but I don't think it is much understood. We can understand it in a more full depth. So let's get started. What is tetanus? Tetanus is also known as lockjaw. It is a serious bacterial infection caused by a microbe or bacterium that is also found in the body as well as animals, that is called Clostridium tetani. Now, as I said, it was found in the body. It is found in the intestines, to be specific. But this produces a toxin that affects the brain and nervous system, leading to stiffness. So here, I don't know if you can see my mouse, but the lower left photo, that is a gram-stained photograph under a microscope, obviously, of the bacteria. What's interesting about it is it looks kind of like drumsticks, so they refer to it as the drumstick-shaped bacteria. And that is because the endospores, which are on the end of the bacillus, this is a bacillus form of bacteria, they are wider, giving them that drumstick shape, that end, kind of like you would see it on a drumstick. So kind of cool. And then with this photo over here, it affects the nervous system as well as the brain. This bacteria produces a neurotoxin which affects how we as people control our nervous system. So it controls our muscle movements, that can be in the face, that can be throughout the whole body, as we will see later. So this is included in the symptoms. Symptoms of tetanus include muscle spasms or stiffness, diarrhea, sore throat, sweating, and a rapid heartbeat. As we can see here in this top photo, this man is suffering from tetanus. He has uncontrol of how the muscles move in his face. This is one of the first common signs or symptoms of tetanus, and a way that doctors or professionals can have a lead into diagnosing the patient for tetanus. This bottom photo I chose to include because it is a famous photo. It was actually introduced in 1890 by Sir Charles Bell. This was his sketch of a soldier suffering from tetanus. It's kind of an awfully frightening photo. As you can see, his back is arched, and this is one of the most severe symptoms of tetanus, as it takes over not only your muscles in your arms and face, but it can also take over the back, the legs, and the feet. The feet you can't see in this photo, but they are curled up. They're digging the heels. It's every muscle really just stretching and contracting and moving. Very awful. I took some notes regarding some of the complications that tetanus can have on people, and one result of these muscle spasms can be fractures. And sometimes in severe cases, the muscle spasms and convulsions may lead to bone fractures, which is also really gnarly. Laryngospasm, I'm not sure how to pronounce that, but this is the voice box that goes into a spasm which can last up to a minute and cause breathing difficulties. In severe cases, the patient can suffocate. So like I said earlier, when tetanus is contracted and reaches that stage of physical symptoms, which, I should have mentioned this earlier, this usually takes up to about a week, or even 3 weeks. sometimes, rarely, up to a month for physical symptoms to come out. Tetanic seizures, if the infection spreads to the brain, as I said, it was connected to the brain as well, because it is a neurotoxin which is secreted out of this bacterium. This person can experience temper tantrums or fits. Pulmonary embolism. This is when a blood vessel in the lung can become blocked and affect breathing and circulation. The patient will urgently need oxygen therapy and anti-clotting medication. And last but not least, you can have severe kidney failure. Severe muscle spasms can result in the destruction of skeletal muscle, which can cause a muscle protein to leak into the urine. This can cause severe kidney failure. As we know, kidneys are essential to surviving, to living, as they do filter the toxins or unbeneficial ingredients which are entered into our body through either food or drink. So the symptoms of this disease are very severe. Luckily, in the United States, there are only 30 cases per year. But when we look at a worldwide perspective, there are up to 800 to 1 million deaths. And 80% of those deaths happen in Africa as well as Southeast Asia. And this is due, strictly because of their environment. So another thought I had while I was preparing to give this presentation was my mission. I served in the Philippines, Tacloban mission, which was the poorest region in the Philippines. And during my time there were two main medical facilities which we would often see. One of them being tuberculosis, and the other being a place for tetanus. And tetanus is most commonly found in contaminated soil as well as manure from animals. Because of the bacteria itself. The bacteria, just to reiterate, is Clostridium tetani, which can be found anywhere, all over. Many people, concur that Clostridium tetani is associated directly with rust, and this is a myth. Back to that first thing I was introducing earlier, which is what we always hear, or at least what I heard as a kid. Clostridium tetani isn't directly associated, or contracting this bacteria isn't directly associated with rust itself. It is associated with the nail because the nail is long enough or big enough to puncture and reach the skin tissue, which is correlated, as we know, with the nervous system, which is what is affected with tetanus. So it's not the rusty nail. It could be a clean nail. As long as it is contaminated with the bacteria, Clostridium tetani, that's when tetanus is a real threat, not the rust itself. So that was what I found out to be a myth. So moving on, we kind of already gone over the causes. As I said here, it is found in contaminated soil as well as animal manure. What's interesting is, like it says in the first bullet, that these spores are able to survive for a long period of time outside of the body. This is how they're able to be found anywhere, really outside. This can either, like I said earlier, come from a puncture or wounds with contaminated saliva or feces, and or burns. So we talked about the nails as well as we talked about the open wounds. That is one of the ways that it is contracted, is through via open wound or saliva, or any way that it can get into the body at a deep enough level. So it's, as stated earlier, it is severe. Needless to say, it's especially dangerous, which is why I think the United States has gone to such a extreme level to prevent this disease from being spread or becoming more common within society. And this is why one of the main ways of prevention is through the vaccine, which I'm sure most of us, or if not all of us, here have received. So moving on, treatment. We'll get to the vaccine later. Skipping ahead, I'm getting excited. But treatment to for the risk of contracting tetanus can be most common, most efficient is proper treatment or proper cleaning of an abrasion or of a open wound. A short-term way of treatment can be found in the TIG shot, or the tetanus immunoglobulin. This shot provides immediate effect and is short term. And mainly this shot, as well as what penicillin does, as shown here, is prevents the spread of a neurotoxin. It slows down the rate of which the toxin can spread throughout the body or the nervous system and create a cause and effect of muscle spasms, which we read in the complications earlier can lead to very serious problems. But then again, like I said, this is short-term effect. What is needed for most people, or for all people, is the vaccine. This is the long-term solution of prevention of tetanus. This is usually given to children in a 5-shot span, or in a 5-shot order of 2 months old to 4 months, 6 months, 15, 18 months, and then 4 to 6 years old. This is the booster shot because it boosts the immune system. And then after that, it's recommended every 10 years for adults. One thing that also sparked my interest in learning about this disease was my mission again. In order for me to go to the Philippines, the church required me to receive this booster shot, is what you could call it, again before I left for my 2-year mission, because that way it would be more fresh and strong in my system, since it was almost 9 years since or just a little over 10 years, since I had received it prior to going on my mission. All in all, the tetanus disease is very prevalent. It is very common in our surroundings, in our environment, but due to our advanced technology and society, it is not as common in the United States. Only 30 cases per year, but usually caught early on, whereas other places in the world, as we learned, up to even 1 million deaths. So that is my presentation on the tetanus disease, and thank you so much.